Welcome to the Perla Bienestar podcast. Meet your host, Perla Puebla, nurse practitioner, healthcare advocate, and wellness enthusiast with over a decade of experience helping people feel their best. This podcast is your space for real, down-to-earth conversations about health, beauty, and everything in between. Get ready for tips and insights to take charge of your wellness journey. Let's dive in.
Hi guys, welcome back. I'm excited today because we are going to be talking about postoperative cosmetic surgery, the importance of lymphatic massage, what you should be expecting postoperative, what things you should be doing for the best way to heal. And also we're going to be talking about the pre-op phase and what you could do to ensure that you are going to heal or optimize your healing journey. And we're going to also just speak a little bit on the mental health aspect of, getting surgery and what happens post-ops and how you feel. We are going to be talking about this with Carmina. So Carmina is an amazing massage therapist. She has been doing lymphatic massage for 7 years. She's very experienced. I love the approach that she takes with her patients, and I think we work very well together to help her patients, my patients, heal and get those optimal results. So let's dive in. Carmina, do you want to introduce yourself?
Yeah, sure. Hi, my name is Carmina. I am the owner of Bodies.
That sounds awesome. All
Okay.
right. So we want to talk about many different things today in hopes that this will be helpful for you guys, for my patients, and for your patients as well. What do you think are the main benefits of post-op lymphatic drainage?
Well, some of the main benefits are going to be a faster recovery. So you're going to experience, with lymphatic massages, you're going to experience less discomfort, more mobility, less swelling, less pain. I mean, and the list goes on and on and on. They're so beneficial. So they do help heal or recover twice as fast if you're consistent with them. So it's a huge, huge benefit that I see with my clients.
Usually, what procedures do people come in? Like, what procedures do they get, and when do they need the lymphatic massages?
Well, every doctor is different. We work with a lot of different doctors. So some doctors will tell you, to get a massage the very next day. Some will tell you to wait 2 days, some 3 days, some up to 10 days. But we recommend coming in for your first lymphatic massage after any type of cosmetic procedure, 1 to 3 days after, which would be lipo 360, tummy tucks, lifts, anything like that.
Okay. Do you think the massages can reduce swelling and prevent fibrosis or other complications?
Yes, absolutely. It prevents a lot of scar tissue buildup as we help kind of move those stagnant fluids out of the system. And we break it up as you come and get massages, so it really helps recover with smoother results. It helps really maximize your results to prevent like the lumps, the imperfections, fibrosis. You know,
Yeah. So, do these hurt, Carmina?
well, that's a huge misconception. Something I would love to talk about. If you do go on into the deep end and Google, or do your research, go into these different post-surgery groups, you're going to hear a lot of women or people say that they are so painful, but they're worth it, and et cetera, things like that. From my experience personally, none of my patients ever complain that it's painful. It should not be painful, actually. They should actually be very comforting and relieving, because of the trauma that that you just underwent with the surgery. Any aggression added to that trauma is actually going to cause more swelling. It's going to cause actually scar tissue. It's going to cause just complications. So they should not be painful at all. They should be actually very relieving.
Yeah, that's important to note, especially because you do have people out there saying that it is painful. So if they are experiencing pain, then maybe they should be, you know, trying to evaluate why that is, or if maybe they should find a different provider.
Exactly. Yeah, exactly. I would definitely do your research when you're looking for someone to take care of your post-op care. Look at the reviews and then ask what type of modalities they use as well. The only thing we recommend within the first 2 weeks of massages is just ultrasound therapy, red light therapy, and hand massage. That's it. Or, just hand massage. Avoid like cavitation or any type of aggressive wood therapy or anything like that. Definitely don't want to do, especially within the first 2 weeks.
Okay. Those are really, I think those are great insights. Now you've been doing this for 7 years. What do you think are some of the most common mistakes people make after surgery when it comes to recovery?
Number one would be not getting massages. I get a lot of people that, their doctor didn't inform them, hey, if you get these massages, you will benefit. So a lot of times we get a lot of people that come in looking for help because at this point they're 2 weeks, 3 weeks, a month, 2 months out, especially with tummy tucks, 2 months out, and they're still not able to walk straight, or they're still extremely swollen and it's still in a lot of pain. So number one is massages. Definitely try to get them as soon as possible after your surgery. They will help you recover much faster and prevent any of those things. Another thing is compression. I notice there's a lot of spas or med spas that offer awake lipo these days. And they do more of not as aggressive. So they just kind of recommend sometimes like skims and, light compressions like that. But to get the best results, you want to absolutely go into a stage two faja. Typically, after 2 weeks of your surgery, if you just got liposuction, tummy tucks, typically about 3 to 4 weeks after they got their surgery. So, compression is extremely important, and also staying away from high sodium, and alcohol. Those will swell you up and actually prolong your healing as well. So those are really, really three really top things that will actually help you with your recovery.
See, those are good. I never think about the sodium, but you are right. It will increase your swelling. Now, I know we talked about this before, and there's other things that we talked about that could improve your healing. I know we said, we talked about the vitamin C, zinc, quercetin. I'm always talking about having the right amount of protein, the right amount of hydration. Um, what do you know about having the right amount of fat when you get a BBL? Do you feel like people are not really educating their patients in the diet they should be having after having a fat transfer?
That's kind of a 50-50 thing. You know what I noticed that in other countries outside of America, doctors really educate their patients on vitamins, compression, massages, and also diet, but not so much here in the States. I noticed that we have to educate those clients coming from, more modern uh, places here in the United States. Um, it's not something that they highly educate on, but it's very important to have a high protein diet and high fat diet after a fat transfer, whether it's to your glutes or to the breast. Now they're transferring fat over onto the breast as well, and that tissue is different. It's a different type of fat, so it has less retention as well, percentage, lower than transferring to the glutes. So it's super important to have high fat and high protein to help that fat survive within the first, 6 weeks of your surgery. So it is very important, but it's not emphasized as much as I would love it to be.
Yeah, I think a lot of things get missed, and either maybe the patient was told, but they forgot because of the amount of information they receive preoperatively, pre-op. Um, but I know we've talked about this before. There's a lot of things that are not emphasized. The vitamins, the hydration, the proper diet, or even we've talked about this, when you should be having bowel movements after when you should be walking, making sure that you're doing deep breathing exercises to also exercise your lungs and make sure you're not getting blood clots and all that.
Yes, absolutely. With the blood clots, I noticed a lot of girls come in and without any compression socks, and that's super important after surgery that to prevent blood clots, especially the first 2 weeks. If you've ever had surgery and you've noticed that your legs do swell right after surgery, um, the compression socks really, really help keep that at bay and, like we said, prevent blood clots. So that's another very important thing too. Um,
Yeah,
I
and
think they're making it so norm, that they're leaving out these little details. Some places are leaving out these very important little details that could be, a big game changer for these patients.
yeah, I know I have seen post-op patients before. When I show up, they have no clue they should really be walking, because of the importance of, yeah, not only, getting your circulation going, but also make sure you're not getting any blood clots. They don't know the importance of drinking enough fluids. They don't know the importance of the vitamins. So these are all, I think, a holistic approach is the best, right?
Oh, absolutely.
And I do think if you're doing all these things and taking the right, right amount of vitamins, proteins, nutrition, and all of that, it really also help with the wound healing itself in hopes that, it heals really well and you don't have any dehiscence or any issues with the sutures, the closing, and all that.
Yes, exactly. Absolutely. It's super important to really do your research and see what type of vitamins are going to help you recover, especially with wound healing. You know,
Yeah. I love the wound healing. I don't like when people have wounds, but I love the wound healing stuff. I think
yeah,
it's very important, especially in wound healing. You want to have enough protein. That's very important, which I know it's hard to do even when you don't have surgery. So I can understand after surgery is a difficult thing, but you need to make sure, yes, you have enough protein. You're also walking, having that mobility, and having the right amount of vitamins. Vitamin C. I love seeing quercetin is great. Having a multivitamin and a multimineral. And, it's not only just about protein, it's having the balanced meals, which
absolutely.
I know it's hard when you've just had surgery, right? Like people don't want to do that. But also there's a bunch of protein shakes, right? They could use to
Yeah,
improve
absolutely.
intake so they're not having those issues with the wounds and they are healing hopefully faster or on time, not delayed.
Not delayed, exactly. And there are things that will delay you. But yeah, those are some great vitamins, vitamin C, bromelain, quercetin, even collagen. Taking collagen actually helps recover wound healing faster as well.
Yeah.
Um, bone broth is a thing that I tell a lot of my patients to drink because of the protein and the fat in it and also the collagen. It's amazing. A cup of bone broth is amazing. Also, there's a lot of different teas that help, with lymphatic drainage, so that their body is constantly, removing all of those fluids that are accumulating every day. A really good tea is actually Cleaver's tea. Cleaver's tea is amazing for postoperative care. And of course, arnica tea that helps with the inflammation, and Cleaver's helps with the lymphatic drainage. So that's an amazing combination to have there, is those teas.
I love my teas. I love the arnica tea. I don't think I know anything about Cleaver's tea. I'm gonna look that up and find out more about it.
Yeah, so that's another great tip is Cleaver's tea with arnica. I'll just mix the two and it's amazing. You will be releasing those fluids all day.
I think when you talk about releasing those fluids too, is if you, I don't know, depending on what the patient is doing, I usually tell my patients on a regular basis, you should be having about 80 to 100 ounces of water, right?
Yes,
But then when
absolutely.
you are losing, when you have drains, right? When you've had surgery, you had fluid loss, blood loss, then you have drains. you're losing
Mm-hmm.
fluid, you really, really should be focusing on that hydration and really not be drinking any caffeine because then you're going to be peeing out, urinating out more fluid than you need to. And
Mm-hmm.
and I find when they call me, it's when they are dizzy, lightheaded, they're super dehydrated because they didn't realize they needed more water. They didn't realize they had to maybe, stop the caffeine because they're thinking they're drinking the right amount of water, but they're losing so much fluid.
Yeah, they're depleting themselves.
Yeah.
Yeah, so I recommend, like you mentioned earlier, having minerals in your water for extra hydration
Yeah.
so that your body's not disposing all of those minerals your body needs as well for recovery. So I love liquid minerals. You can find those on Amazon and they really, really enhance hydration. So that's another good tip. And I hear a lot of people mention, oh, I thought I shouldn't drink so much water because I will swell up more. I'm like, no, it's quite the opposite. You're depleting your body of water, so it's retaining to more fluid, you know. So yeah, there's a lot of little misconceptions that are really good to talk about, actually. Because people don't know, they only know what they research. And honestly, a lot of this information out there is actually quite false or, you know,
We're not
not very
helpful.
beneficial. Yeah,
Yeah.
exactly.
So I want to ask you, what do you think or what do you know about the emotional roller coaster that patients or clients go through once they have
Oh
surgeries,
my,
cosmetic surgeries like this?
oh my God, that's a really good question that doesn't get talked about a lot, but gets brought up a lot by patients. So after surgery, it is so common. I would say about 70 to 80% of patients get, some type of depression after surgery. Because of number one, expectation. They were not expecting maybe to feel this way. Or you know what I mean? Maybe they didn't expect it to be so painful, or they were expecting faster results. But also what I actually realized is it's also so common because of so many antibiotics that you have to take right after surgery that actually messes up your biome, your stomach biome, like in your gut. And that really, really has a lot to do with emotion. It will completely send, you know what I mean, mess with your emotional state because of the gut biome. So we recommend, taking pre and probiotics because it will prevent also you feeling so depressed afterwards. I think the antibiotics play a big factor in it as well. It's something that I didn't realize before.
Yeah, I'm glad you mentioned that because I totally forgot about that. Yes, they are put on antibiotics, which disrupt your gut. So then you should be on pre and probiotics. And that reminds me as well, then you're put on narcotics, right? Which you need them, but then you also
Hmm.
should be reminded, the shortest amount possible. But also let's make sure you're not getting constipated from those medications and bowel movements are going to be very important. So I do agree that I mean the physical pain, the trauma they're going through, and maybe they weren't expecting this, it's all causing them to have those depression or anxiety or shame or regret
Exactly.
because they're
Regret.
in regret, right? I feel like some people can feel regret or even
It's extremely common, especially the first 2 weeks to sit, for people to be like, oh my God, why did I do this to myself? Like, did I really need to go through this? I'm not even happy with my results. There's a lot of things that go on that are unspoken about. That's a huge one. Um,
So do you feel there could be something that patients could be doing before surgery to mentally prepare for this and that maybe we're missing that component, right? That patients are getting prepared every other way, but they're not getting prepared mentally for this journey,
exactly. And
right?
it's hard. Exactly. It's kind of tough to prepare mentally, especially when you start, like I said, mentioned earlier, when you start searching, the web for all this information, and you get so much misinformation, so many contradictions. And what I would recommend is not going so far into searching so much, because you're going to get so many contradictions. But like you said, prepare yourself mentally, and have patience. That's the biggest thing with recovery, is you need to have a lot of patience. Just remember, before you get your surgery, I'm going to have to be patient with myself. I'm going to have to be patient with my body, with my healing, with my mental state. I think patience comes a long way with when you're preparing yourself for surgery, and also, making sure that you're healthy beforehand, because you will have an easier recovery if you're already hydrated, if you've already started taking these vitamins, started taking collagen and iron, or
Yeah.
whatever you're deficient in, vitamin D, magnesium, zinc, folic acid, and the list goes on and on. You will have a smoother recovery as well.
See, I love that. I don't know what lab tests are done before a cosmetic surgery. I don't, right? I don't work with pre-op patients in cosmetic surgery, but I'm wondering, I do agree, you do have to strategize, pre-op, post before you get the surgery. And yes, get yourself in the best shape. Make sure you are eating well, taking all the vitamins so your body doesn't have a hard time healing and you can heal at the right time or even have a speedy recovery. But I think it's going to be important to maybe create awareness about the mental health aspect so people can be aware of it, and maybe that awareness will help them through it. Like, oh, I know I might feel this way, and I'm going to have to be patient with myself and make sure I have a good support system. Make sure that I have realistic expectations and hopes that that'll help them through that phase of, feeling all these things after the surgery.
Exactly. Exactly. Those are all perfect points.
I love that we're talking about all this, and I really hope that your patients can really benefit from this talk so they can either prepare themselves, or now that they are going to the post-op period, that if they don't know some of this information, they can, start putting it into practice.
Yep, exactly. Um, yep, I would recommend, even if your doctor didn't send for, your labs, to see what you're deficient in, because sometimes they just check for specific things. I would highly recommend just getting a full panel to see what you're deficient in, at least, 2 to 3 months before your surgery minimum. And then just kind of start supplementing that into your diet every day to make sure that you are healthy. You will have a way better, smoother recovery mentally, physically, emotionally, so I think all of those are really good points. Yeah, I hope this helps people get a better understanding, a little clearer, of what post-op recovery, you know, is, and what it should be, I guess.
Yeah, and then also, you know, make sure people know that we are here if they have any questions. Um, if we don't have the answer, we can definitely help you find the answer. But I mean, I know, Carmina, you have many years of experience doing this, and I think that's wonderful. I love how your patients, they love coming to you and how you educate them in all this, which I found really interesting because, I love all the vitamins and stuff. And when I heard you talk about this, I was like, yes, this is so important. Let's tell everyone to take all the vitamins, to do all these things that you should be doing to optimize your recovery.
Absolutely. And that's where, people like you come in that do IVs. The IVs are super beneficial because you can, include any vitamins that you need. And they really does help hydrate your whole body and get those vitamins straight to your bloodstream. And yeah, I know that they can get some IVs to help speed up recovery. I know you have some concoctions that you have specifically for post-op care. So
Yeah.
they can look into things like that post-surgery as well.
That is true. I did create a post-operative, I think it's like about 19 pages, is all the things from a medical standpoint, what I think they should be doing to optimize their healing journey. I have it, I'm gonna see if I can post the link so they can, if someone needs it, they can, buy it there. But also, if they have any questions, they can ask me about it. And sometimes I don't think everyone needs an IV, right? Like if you are doing all these things pre-op, post-op, you might not even need an infusion, right? If you are being proactive with these things, you might not need an infusion. Just because I don't like people to think, oh, you do infusions, you want to put infusions in everyone. No, I want to make sure you are healing and doing well, which is why I want to educate you and things that you should be doing pre and post-op. So you don't need an infusion. Because if you need an infusion, sometimes it's because you're dizzy, lightheaded, you're super dehydrated. That means, there should have been better education there. And
Yeah,
I do think IVs can help, faster recovery because they're going to have vitamin C, zinc, amino acids, and the hydration that you need. So I do think they can help with faster recovery. But I think it's important to note that everything a holistic approach is best, not just the one thing.
absolutely. Yeah, it's totally optional, but if you do want to speed up your recovery, you can it's definitely a great option, to add an IV right after surgery. I have noticed a big difference with patients that do and that don't. So it's a huge difference.
Yeah.
Very beneficial.
All right, Carmina, I think this is all great information, great conversation. Is there anything else that you would like to add?
Um, I
It,
mean, there's so many things to talk about, but
I
I
know.
think we covered most of the important points of healing. Now, everything else, I guess, is, for another day, more detailed
Yeah.
information. But yeah, I think I think we covered a lot of really good points.
If people want to find you, where can they find you if they have questions for you or they would be interested in any of the services that you provide?
Yeah, they can go to my Instagram page, Bodies LLC, all one word. You can Google me, Bodies LLC Phoenix. You can message us on Instagram or you can call the number on Google. We can answer any questions. We do offer full body lymphatic massages. Um, Also, if you want to get one right before surgery, it's extremely beneficial as well. It kind of kickstarts your lymphatic system so that it's draining a lot better, helps detox your body so that once you get surgery, you have a faster recovery as well. That's another thing I should have mentioned. You can get a full body lymphatic massage before surgery. That definitely helps speed up your recovery as well. It'll help your body kind of get rid of those fluids and that inflammation a little bit more adequate after
Yeah.
surgery. But yeah, just message us on there, but you can book online. I'm more than happy to answer any questions. Yeah, thank you guys so much for your time.
Alrighty. Well, we're going to see you guys in a couple weeks with other amazing topics. I think this is something that we should revisit because there's so much more we can dig into pre-op, post-op, so many things. So we'll have to do another session like this.
I would love to.
Alrighty, guys. We will see you in a couple weeks. Bye-bye.
Thank you for listening to the Perla Bienestar Center podcast, where your health and wellness comes first. Don't forget to subscribe, and for more information, find us on Instagram or visit us at perlacenter.com.